Hello everyone, welcome back to my channel, and in this video we are going to discuss about the second part of the chapter number 2 of the evidence-based practice. I hope you have watched the previous part of this video, and in that video we have discussed in a great detail about the overview of it and the relevant questions and what are the questions that can be formulated from a scenario which is given to you, and we have also categorized those questions. So all that was related to this topic discussed in that previous part, but still there is much to be discussed in this video as well about each of the categorization in the great detail. So without any further delay, let's get into it. So first of all, what is refining your question? So refining your question means that you are structuring your question, you are refining your question so as to make it easier for you to find an answer to it. So how are you going to do it? You basically would take a scenario and then you would probably break that into the different parts so that you can get a good outcome out of it. And this is basically an example of what we did in the previous part of this video. We discussed a scenario and then we broke that scenario into the different parts, and then we formulated different questions related to intervention, experience, prognosis, diagnosis. And in this part, we are also going to do the same thing but with a great detail. Now, the second point is specify objectives hidden in the questions. Objectives hidden in a question means that, for example, if the question is related to diagnosis, so you would specify that this question is related to diagnosis. It means that you would structure your question in a way that would seem to you that it is related to diagnosis, say, or if it is related to any other category that you want it to be related to. Okay, now let's discuss each category of the questions one by one. So first of all, we have the effects of intervention, and the questions that are related to the effects of intervention, they are further categorized into 4 parts. All right, we discussed them in 4 parts. So these are the following parts. The one is patient or problem, and that is the P. Then we have the second part is the intervention or the management strategy. Then C for comparative intervention, and then the O is for the outcome. And the very basic mnemonic that is commonly used is the PICO for it. So the P for the patient problem, I for intervention, C for comparison between the interventions, and the O is for the outcome. Now let's discuss each of these elements one by one. So the P is for the patient or problem. The first point is that identify those characteristics of the patient or problem that are most likely to influence the effects of intervention. So alright, let's discuss a case that, for example, if the person is having the heart condition, and many of the characteristics of the patients are given to you, that the person is a male and he is 40 years old, and it is also told you about that he is hypertensive. So which characteristic is, you think, most likely to influence the effect of intervention? So definitely it is the hypertensive. The being hypertensive is a major cause of the heart problem, and if you're going to control that hypertension of the patient, so it is going to save the person from worsening of the heart problems. Then the second point is specify enough detail to get a relevant answer, but not too much detail that you won't get any answer at all. So this point is telling you, for example, if you are searching for a kind of evidence related to your condition of the patient, and if you are going to mention all the details, if you are going to specify it too much about the patient's condition, so if you're gonna specify it too much, so this is gonna shortlist your evidence to such a number that you won't be able to get any answer at all to that condition. But if you would specify it enough to get a relevant answer, so there are high chances that you would be able to find the best evidence to your asked question. Now we have I and C, that is I for intervention and C for comparison between the interventions. So basically the first one here is that concerned with intervention. So yes, they are basically concerned with the intervention. Then we specify the intervention that we are interested in and what we want to compare the effect of that intervention with. So basically what intervention we are recommending to the patient, so we have to list that intervention in the category of the I, and then in the comparison we would list down the intervention we want to compare the intervention with. Okay, don't worry if you are having a vague idea about what we have discussed until now. So let me tell you that we are going to discuss an example that will clear all your concepts. Now coming towards the C, so C for the comparison. So Now, what kind of interventions we can compare it with? So we can compare it with no intervention at all. So in that case, we are going to mention not applicable in that category. Or if the interventions are actually available, so you can compare it with the sham intervention. Now, what is sham intervention? In which the doctor would actually perform the motion of the intervention but not actually treating the patient. So you can say that the patient here in this case is treated with the release of good feel hormones from his brain, so that the patient has a feeling of the pleasure when he is treated with a sham intervention. But this is not an actual treatment, because the doctor is just gonna perform the action or would perform the motion of the treatment. All right, what's next? So the patient, yes, so the intervention can be compared with no intervention at all. So if there's no intervention, so no intervention. And then the sham intervention, or if the person is treated with another active intervention, for say it he is being treated with the drugs as well as the exercise therapy, so you are going to mention with the active intervention. For example, if the patient is being treated with the exercise therapy and the drug interventions or the drug therapy, so if the patient is right now being treated with the drug therapy, so you would mention drug therapy under the I category, and the previous treatment, the previous intervention that the patient was receiving, for example, if it were the exercise therapy, so you are going to mention the exercise therapy under the C category, the comparison category. Then O for outcome. So what is this telling you about? So it specifies what outcomes we are interested in. So basically in this category we have to tell about what outcome we want. For example, if there is an injured worker, so whether you want the reduction in the pain of the patient, or you want the reduction in the disability, returning to the work, or other. Now, the patient is a main stakeholder when it comes to choosing the outcome, measure, and setting the goals of intervention. So, now what is this telling you about? That the patient is actually the main character that would tell you about what outcome he would choose for, whether the person wants the reduction in the pain, reduction in disabilities. So, this is basically something that is told by the patient, that what he wants. And this is going to in turn determine the outcome measures and the interventions you are going to suggest the patient. Now let's understand it with the help of an example. So the scenario is here: in patient with acute low back pain. So this is basically the previous scenario which we have discussed it in the previous part of this video. So in the patient with the acute low back pain, does bed rest or advised to stay active produce greater reduction in the pain or disability? So now here, as I've mentioned, the P is for the patient and problem. So this would be the whole part. So this whole statement is going to be the P, the patient with acute low back pain. Then now for the I, it is the intervention. So the bed rest is going to be the intervention here. And then what you are going to compare this intervention with, so advice to stay active. So this is what you are going to compare with the bed rest. Bed rest is the intervention, and advice to stay active is the intervention you are going to compare it with. That is why it is the comparison. Now we have the outcome. Now what is the actual outcome we want? So this is the pain and disability reduction. So reduction in the pain and disability is the outcome of us. Here you can see P is the patient with the acute low back pain, I is for the bed rest, C for advice to stay active, and then the O is for the pain and disability. Now let's talk about the experience of the patient. So how the patient feels about the condition, that is basically the experience. So the experience can relate to any aspect of the clinical practice. So as I've told you before, that these type of questions are basically the general questions. So the patient can share with you any type of experience. It can be related to any aspect during the whole clinical course. So now this point drives us towards the next point, that is, as they are potentially very diverse, they must be relatively open. It means that the patient should be given an open-ended question related to it, that what is your experience. So as it is an open-ended question, so the patient is open to share any of his experience during his clinical course. Now the next point. Now what is recommended when we are asking these type of questions? So it is to specify the patient or the problem and the phenomena of interest. When the patient is telling you about his experience, so you should be very much specific about the patient and what problem he is suffering from and what is the interest of the patient. Next point is that patient's attitude to his condition. So the experience means the patient's attitude to his condition. It means that whether the patient takes his problem very much seriously, or whether the patient does not care about his illness, or he doesn't want it to be treated. So these can be the different types of attitudes of the patient towards his condition. An example is given here: patient expressing concern about whether his complaint might become chronic, or whether he might have a serious illness. So here you can see that the patient is very much serious about his condition, that it might get chronic or he might develop a serious illness, so it must be treated. So this is one of many attitudes to the condition. Okay, now let's discuss it with the help of examples. So now we have a similar scenario as we discussed in the previous video as well as in this video. So that patient with the acute low back pain. All right. So now the question here can be, what are the principal concerns of the adults with acute low back pain? So here the patient and phenomena are the two categories, two parts. We are going to divide that question of the experience into. For the questions of intervention, we divided that question into four parts, PICO. But here in this question, in the question of experience, where we are going to divide it into two parts, the patient and phenomena. So the patient here is again the patient with the acute low back pain, and the phenomena here is the principal concern. That is what he believes is important to him according to the condition is going to be his principal concern. Then we have prognosis. Now, when you are designing or structuring a question for the prognosis, you should specify the patient, that is, what is the age of the patient, or what are the specific characteristics of the patient as we have discussed, or the problem of the patient, and you should also mention the outcome you are interested in. Because in a prognosis, you are going to look at when you are going to achieve that outcome, or how much is the probability of that outcome to be achieved, or what is going to be the expected amount of the outcome that is going to result from that intervention. So here the outcome is very much important in the types of questions that are related to the prognosis. So here as well you can see that the questions may be about expected amount of outcome, probability of outcome, or you can also ask about the time frame of the outcome. We can ask the questions about prognosis of people who do not receive the treatment. So there are two types of people we can ask the prognosis questions for. So if there are people who do not receive the treatment, so that is going to be the natural history of this condition. Then if there are people who are receiving the intervention, so the prognosis for those patients is referred to as the clinical course of the condition. All right. So if they are not receiving any treatment, so that is going to be referred to as a natural history of the question of the condition. And if the patient are receiving intervention, so it means that the prognosis, the question that is related to prognosis, is going to be referred to as a clinical course of the condition. Now let us discuss it with the help of the similar scenario. And here we have the question, the type of question that can be raised in this part can be: in patients with the acute low back pain, what is the probability of being pain free within 6 weeks? So here you are discussing about the probability of what, of the outcome, that is pain free, being pain free, and you're also discussing about the time frame, so within 6 months. So this is a question about the prognosis. So now what you can mention here, again the questions that are related to prognosis can also be divided into some parts. So we have the two parts here. One is the patient. So in the patient you are going to mention the adult with the acute low back pain, so again the patient with the problem. But now the second part is outcome and the time frame. So the probability of being pain free within 6 weeks, this is basically your outcome, as well as the time frame is also discussed here. Now let's talk about the characteristics of the questions that are asked about the prognosis. So now the questions about the prognosis are the questions about what will happen in the future. So here what you're concerned with, that what is going to happen in the future. You're not concerned about the causes of what will happen in the future. So you are just concerned about the actual thing that is going to happen in the future, not about the cause of that thing. So it means that you are concerned with what that person's outcome will be, but you are not concerned with the why questions, that why it will be. So it means that you are not concerned with the cause of it, but you are concerned with what is actually going to happen in the future. Alright, now let's talk about the diagnosis. And this is going to be the last category which we are going to discuss about, and then we will discuss about the types of questions. So here in the diagnosis, what we can see is that even the best diagnostic tests occasionally misclassify the patients. Remember the example of the scenario which I've given you before in the previous video? So basically in that scenario, we had a patient who was having the acute low back pain, and the statement that was present in the scenario was that the patient has no apparent neurological deficit. even though it was mentioned that the patient has a radiating pain. So the misdiagnosis does happen. It is, you can say, an unavoidable part of the professional practice, because the doctors sometimes they don't thoroughly examine their patient, and then they just misclassify their patients. So this probability is very much likely to happen. So what you can see here is that even the best diagnostic test occasionally misclassify the patients. Misclassification and misdiagnosis are an unavoidable part of the professional practice, as I've just discussed. So the research literature can provide us with the unbiased estimate of the accuracy of diagnostic tests. So in this way we can be helped. And when you are asking the questions about diagnostic test accuracy, you should specify about the patient, what problem he has, diagnostic test, and the diagnosis for which you are testing. So these are all the information you should also specify when you are searching for the answer to your question according to the evidence. Now let's understand it with the help of a scenario. So the scenario is radiating pain corresponding with the L5 dermatome. So this is basically the reference that is taken from the similar scenario which we have discussed it in the previous part of this video. So doesn't have the sciatica. So here in the previous scenario, this was told that the patient has no neurological deficit. So the doctor was telling him that he doesn't have any sciatica. But the patient was telling that the patient has radiating pain and this is corresponding with the L5 dermatome. So how we can neglect it? So this definitely urges us to go for the further evaluation of the patient. So further clinical examination using the Leslie-Guilla's test to find out the nerve root compromise. So now what we are doing in order to see whether the patient actually has a nerve root involvement or not, we are performing the Leslie-Guilla's test. And Leslie-Guilla's test is basically the SLR, which you know is a straight leg raise, in which the doctor elevates the leg of the patient with the knee extended, and the person would experience the pain in the pelvic region and in the leg when there is actually the nerve root involvement. So this test can actually help us to rule out whether there is nerve root involvement or not. So now let us see with the help of example what can be the question related to this is in adults with the acute low back pain, how accurate is Leslie-Guilla's test as a test for a nerve root compromise? So as I've told you that the questions that are related to diagnosis are actually the questions that are asked to know the accuracy of any type of particular test which you are using for diagnosis of any condition. As here in this case, you can see the Leslie-Guilla's test is being used in order to rule out whether there is nerve root involvement or not. So this is basically a question that is asking for the accuracy of the test that can help us to diagnose the condition. So now we can further break it into the three parts: the patient, test, and diagnosis. So the question of the diagnosis can be broken into three parts. The patient, so in the patient definitely you are going to mention the adult with the acute low back pain. In the test you are going to mention the test which you are performing or the any kind of special test. All right, so for example in this case we have the Leslie-Guilla's test, and in the diagnosis you have to mention what you are using this test for. So the Leslie-Guilla's test is to indicate whether there is nerve root involvement or not. So you're going to mention the nerve root compromise in the diagnosis. Alright guys, now let's discuss about the last part of this lecture, and that is the types of questions. So the questions can be background questions and the foreground questions. So now let's discuss them one by one. First of all, we have the background questions, and these are the questions that are asked for the general knowledge about a condition or a thing. Alright, so these are the questions that are related to the general knowledge of a condition, and they reflect a desire to know about the nature of the patient, problem, or need. So basically you ask these type of questions so that you can know about the nature of the condition or the nature of the need of the patient. Then often focus on the medical aspect of the situation rather than on the physical therapy component. And we will discuss this with the help of an example below. But first, let it be completed. Now, the next point is that the physical therapy students and the new graduates will use to learn about the new technique or skills. It means that these types of questions, they are asked by the professional ones as well as by the non-professional ones. So the students or the new graduates can also ask it so that they would learn about the new techniques or the skills, as well as the experienced professionals can also use this. So they will use the background questions for the new or the unusual situations. Because if there is a new or the unusual situation, so the experienced profession wouldn't know about this. So for the general knowledge of this condition, of the new condition, so he would ask the background questions related to it. Now let's discuss about the background question with the help of example. So how long will it take for a total knee arthroplasty incision to heal? So this is basically total knee arthroplasty incision is a medical procedure. And this question you can say is related to the general knowledge about that how long will this procedure will take to heal. So this is a general knowledge about it, or you can say the nature of the procedure, nature of the healing that will take place after this procedure. So this is a background question. Then we have what are the signs and symptoms of an exacerbation of the multiple sclerosis. So again, this is a general question and this is related to the medical condition. Now let us discuss about the foreground questions. So these are the questions that are asked for the specific knowledge. Those were the questions, the background questions were asked for the general knowledge. Now these are the questions that are asked for the specific knowledge to inform the clinical decisions or actions. So it means that these type of questions would help you in order to inform the clinical decisions or actions, that what decisions you have to take, what actions you have to take. So these questions are going to help you out with this. And these type of questions also help about managing patients with the disease. So they help in management, they help in decision making, in the actions taking. Let's discuss about the next point, that is have 3 or 4 essential components. So here as well in the foreground questions we have the PICO method. We use the PICO method here, but the C component in it can be optional, so we can mention it if it is relevant to the clinical condition. Now let's see the examples. In the young children with the acute otitis media, is short-term antibiotic therapy as effective as long-term antibiotic therapy? So here this type of question is basically a comparison between the two types of interventions. So this is helping us in the clinical decision making and in the actions and the management of the patient. So this is a type of the question that is a foreground question. Alright guys, and that's all. And I have put all my efforts into making these notes. I really tried to include each and every single point and even the details from the book so that I won't miss any point from the book. And I've tried to explain each and every point with the help of an example so that you can have a crystal clear concept about it. So I hope you enjoy this video. See you in the next video. Bye bye.